heart diseases are common in men. I get it. We always talk about when it comes to heart diseases, we always talk about like men and heart diseases related to men. But do you know the fact that heart diseases are more common in women as well? A lot of people don't know that. I'm Dr. Nandini Sankredi. I am board certified in family medicine, obesity, and lifestyle. I have a wonderful physician here today to talk about that. It's Dr. Lalita Madhupalli. She is a non-invasive cardiologist. Having a woman cardiologist in Atlanta is very rare, and she's one of them. And she's a non-invasive cardiologist. She has a special interest to cardiac oncology. On top of it, she's very, very involved in Georgia Academy of Physicians of Indian origin. She's an inspiration for all of us. She's the most vibrant physician and she's most inspiring physician for all the women physicians around in Atlanta. I welcome Lalita. Lalita, could you talk a little bit about yourself?
Oh, yeah, sure. Thank you for that introduction, Nandini. Yeah, I have, passion to spread the word for women and heart disease as, women, perceive our symptoms differently. We have a lot on our plate. We give importance to, taking care of others and children and, several shoes we wear. But at the same time, women, you know, uh, when they have these symptoms, they need to know when to reach out for their own better health. So, for that reason, I do lots of editorial contents and speaking engagements and American Heart Association events to raise the women heart health awareness, like you're doing. Thank you for this, for
Yeah,
helping
that's
us.
yeah, thank you so much, Lalita. That's like very needed topic now, especially with the women challenging conditions what we're going through and the leadership positions what women are definitely. And Lalita, my question is, how common is the heart diseases in women? Like,
Heart number cardiovascular disease is number one cause of killer both in men and women. Uh, men, most of the men get it, as you said, but women think, breast cancer possibly, or other related illness to cancer is possibly the most common cause of death. But 1 in 3 deaths in women are due to heart disease. 1 in 31 deaths in women is due to breast cancer. Um, approximately every 40 seconds someone in United States will have a myocardial infarction, and according to 2019 statistics, every 3 minutes and 30 seconds in United States are suffering with strokes. So 1 in 5 women know that heart disease is number one cause of death. So it is prime, as a physicians and to healthcare workers to raise awareness among women so that they can take care of themselves, do preventive measures, and prevent heart disease.
wow, I mean, that's scary. Those numbers are really scary. Oh my God. I mean, the incidence is rising quite high, I think, with all the stress what everybody is going through in general. But yeah, and the awareness is very important, I think. Yeah, and do women actually know that it's heart diseases are so common?
Women, as we had discussed, women think that, oh, okay, they have, men usually present themselves as Hollywood picture, retrosternal chest pain, angina, tightness, pressure, exertional symptoms, whereas women, they have non-traditional symptoms. They perceive differently, they project less, and they have associated symptoms like nausea, vomiting, or not feeling right, or fatigue, and they blame it on, oh, you had a lot to do today, let's give it up for that. And they have non-traditional symptoms, hence they write it off. So they project themselves less and reach the healthcare facility late. And that's how women heart disease, probably because of perception, projection, associated symptoms, non-traditional symptoms. Women possibly don't think that heart disease is what they're having. So uh, that's where they're lagging behind.
Yeah, and as women, we always put like everybody's health in front of our health, definitely, and we wear a lot of hats, and now, so definitely we try to ignore most of the signs and symptoms. But what are the warning signs, like, I mean, specific for women, what they need to watch for when it comes to
Uh,
heart disease?
Right. Yeah, that is very important. If in case they are unable to finish their task, not just once, tiredness or fatigue, or, I just can't get this done, or, dyspnea, shortness of breath, exertional, or constantly any exertional fatigue, exertional shortness of breath, exertional chest pain, or some jaw pain, or inability to failure to thrive kind of symptoms. Not Women may have chest pain too, but they are also tend to have more non-traditional symptoms. So they should be on lookout for any exertional symptoms, what we call as anginal equivalent symptoms, need to get to the attention of their primary care provider, or healthcare provider, or family practice, to so that the the physician can jump on it and to accordingly recognize that this is angina or anginal equivalent symptoms, and get to their health needs quickly.
Oh my God, this is scary actually, because these non-traditional symptoms can be there in any disease. And a lot of times, like, women think that they are anemic and that's why they are tired, or they've done too much today and that's why they are tired. So, like, I mean, fatigue is like very non-specific and it's easily missed.
Yes,
Yeah,
yes.
it's actually very scary, as you told. Like, men always present with a Hollywood fracture, and people get scared because men's heart disease is well known. But yeah, definitely. And what are
Yeah.
the risk factors, do you think, Lalita, which puts women under high risk for heart disease?
Yeah, so non-modifiable risk factors like age, 45 male and 55 women, and women get to the menopausal age, perimenopausal, and natural hormones are, going down, and then abdominal obesity sets in. And so age and family history, we can't do anything about it, but what we call as modifiable risk factors, like high blood pressure, high cholesterol, and diabetes, smoking history, and physical inactivity. When we look at the stats, when compared to men and women, the women are more obese compared to men. The total overweight, and men are overweight more and women are more obese more. The metabolic syndrome sets in once they get the menopause and postmenopausal age. Abdominal obesity, muscle mass goes down, the number of steps they take are less, physical inactivity sets in, and sometimes the diet may get altered. So all that modifiable risk factors play a role. But also women tend to have unique risk factors, like pregnancy, gestational diabetes, preeclampsia, stress and depression is a lot on their plate. Autoimmune diseases are more common in women, and perimenopausal hormonal disturbances with be associated with insulin resistance, and proatherogenic lipid profile goes up, like HDL goes down, triglycerides go up. And sometimes women also take oral contraceptives. Uh, if women may have gone through breast cancer too, during that anthracycline based chemotherapy, chest radiation will increase the risk. And autoimmune diseases heart is a connective tissue organ. Cardiac manifestations include uh, pericarditis, increased pressure in the lungs, pulmonary hypertension, so all these make so much, puts women in a unique, more vulnerable state compared to men with, classic modifiable risk factors and non-modifiable risk factors. So that's how I think we as women physicians and all others um, to be a special eye on people coming in with PCOS, like polycystic ovarian syndrome, or they have autoimmune disease, or they have gestational diabetes history, or premature menopause. And, these are all cardiac risk enhancers, and we have to have special eye and ear for our patients, and, risk stratify them and guide them towards aggressive preventive measures.
Yeah, no, that's actually scary because these diseases pretty much became daily routine pretty much. Like every one in like two or three women have this PCOS or gestational diabetes or diabetes or insulin resistance, obesity. It's become a part and part of our living right now.
Right.
So yeah, definitely. And Lalita, I always think that it's harder for women for treating heart diseases in women than in men. Can you tell us a little bit about that?
Yeah, according to the data, we all know in many of the, the research studies, women are excluded, so because of the underrepresentation of women, the treatment modalities available out there are more focused and, geared towards men's health. Whereas, so women have smaller hearts, smaller, the heart, the cavity size is smaller, and they have more diastolic dysfunction, more stiffer heart, more smaller arteries compared to men. So their treatment, the way we treat the men is not same as treating the women. So because of underrepresentation, and also possibly, as we talked about in the previous conversation, that they delay their care, getting themselves attributing to all non-traditional manifestations, blaming on acidity or panic attack or anxiety or too much I did today, and, get to themselves to that, delay the care for themselves. And also, when they reach, the data shows that patients who had myocardial infarction, when we cath the patients, for if in case 10% have obstructive disease in men, only 3.4% in women had blockage is really obstructive disease. And that's because they spasm more, stress-induced cardiomyopathy, the is more common in women, heart failure, and even the door to balloon time, what we call is when patients come in with acute heart attack, we take them emergently to the cath lab and try to open and put a balloon, and because women come late, and by the time they're recognized with these non-traditional factors and, get to the door to balloon time, studies have shown that they get the first treatment delayed by a few minutes. So everything adds up, patients presenting themselves late, access to themselves late, and the treatment modalities are not exactly what, they're really studied previously in research data. So all these put women to, awareness, access, delivery of care, all are different in women compared to men. That's what makes it so difficult to have women with cardiovascular disease compared to men with cardiovascular disease, discrepancy and disparity.
Um, Definitely, like delayed healthcare delayed is always healthcare denied. I mean, it's well said. Like, I mean, yeah, definitely. because they delay the care so much, and it's by the time they present, it's always hard for you guys to treat. And even coming to the primary care with all these symptoms, like, I mean, first step is like the women keep blaming that they are doing a lot more.
Yeah, right.
Yeah,
Yeah.
yeah, definitely, yeah. And Lalita, what are the lifestyle changes you recommend, like for women especially, to prevent these cardiovascular diseases? And what should they do?
I always advocate for primary prevention. Primary prevention is before even you get the disease. So knowing the risk factors, knowing the numbers, and American Heart Association has Go Red for women and simple 7 metrics for cardiovascular health promotion, like primary prevention to prevent disease and to begin with. The 7 factors is stressed, or of course smoking and non-smoking, body mass index, that's weight kilogram per meter square, less than targeting 25 or less, and physical activity at goals. Set your goal. New year is a new you. It's already 2023. Okay, let's make a resolution. 10 minutes a day or 30 minutes a day. The guidelines speak about 150 minutes a week of physical activity. And diet, set the standards for Mediterranean diet or DASH diet, which are recommended by American Heart Association, and targeting their cholesterol level total less than 200 at least, if not breaking down to LDL, HDL, and targeting blood pressure less than 120 by 80, and set standards of blood sugar level less than 100 milligrams per deciliter. So the top, I usually kind of explain to my patients like ABCDE, be aware, blood pressure, C is for cholesterol, cigarette smoking, D is for diet and diabetes, and E and exercise. And there you are. If you get those five fingers in your hand, then you can live longer and healthier. So I think, and also going through, there are so many risk enhancers out there for calculating the risk by Framingham risk score, or apps, ACVD risk score. These days, you plug your numbers, your risk, or calcium score, heart scans, and things like that, which also helps for risk enhancers, and thereby, primordial prevention. So, and knowing their numbers, following their physicals, keeping up with their numbers with their primary care provider will 1 ounce with little of prevention is worth a ton of cure. So that, that's what I would encourage my patients, especially women patients who have risk enhancers. I call to their attention the problem is now, later may be too late. So just get on your numbers and you drive your car. You know your numbers, you're driving your car towards prevention. So that's how that's increasing the awareness, and knowing, letting them know heart disease is #1 cause of killer, and prevention is the best treatment.
Yeah, thank you so much, Lalita. Yeah, definitely lifestyle changes are the must. I mean, if you want to prevent any disease, and I've been making you guys like aware of that. Like every week, I've been posting their videos about various lifestyle changes, what we can do, and thanks, Lalita. Thanks a lot. Like you touched upon like most important things, most important topic which women definitely ignore. And please guys, please be aware of these signs and symptoms. And if you have any of your parents or your in-laws or anybody, like, I mean, or any of your any of the women surrounding you having these kind of symptoms, please make them aware that they need to go see the doctor and get all the cardiac checkup done. They cannot ignore these signs and symptoms, which because these are very important. And always prevention is always better than cure.
Yes.
So yeah, if thank you so much, Lalita. And do you want to say anything for
No,
women?
yeah, go red for women. Red is beautiful. At the same time, just get the heart taken care of, cardiovascular health. Thank
Yeah.
you, Nandini, for raising the awareness.
Thank you. Thank you so much. And if you like this video, please share it. Please comment on that. And don't forget to subscribe to my channel, Stereo Health MD. And if you have any questions, please go ahead and email me at stereohealthmd@gmail.com. It's all about helping you to live a good lifestyle and feeling great. Thank you.
Thank you.